heart of the Deep South, beneath the sweltering Alabama sun, a sinister secret was taking root, a secret that would span 4 decades and shatter lives. It was the 1930s, a time when whispers of race and disease danced through the air, and the lives of many were deemed expendable in the name of science. A group of men, unaware of the storm brewing around them, gathered in Tuskegee, drawn by promises of treatment for what they called bad blood. These were not just any men, they were fathers, brothers, and sons living in a world where their skin color dictated their value. One by one, they were recruited into a study that would forever alter the course of their lives. The doctor said, "Free medical care, we'll help you." Little did they know, the very people they trusted were mere puppeteers pulling the strings of a cruel experiment. The intent of the study was to record the natural history of syphilis in black people. The study was called the Tuskegee Study of Untreated Syphilis in the Negro Male. A total of 600 men were enrolled in the study. Of this group, 399 who had syphilis were a part of the experimental group, and 201 were control subjects. Most of the men were poor and illiterate sharecroppers from the county. The men were offered what most Negroes could only dream of in terms of medical care and survivor's insurance. They were enticed and enrolled in the study with incentives including medical exams, rides to and from the clinics, meals on examination days, free treatment for minor ailments. The Tuskegee syphilis study began with the hope of understanding a disease that was ravaging communities. Researchers, cloaked in the guise of benevolence, tracked the progression of untreated syphilis while the men, still in the grips of ignorance, believed they were receiving compassionate care. As the years passed, the men grew sicker, their bodies betraying them, while the researchers took notes, their pens scratching away at the humanity of the subjects before them. As the 1940s rolled around, penicillin emerged as the miracle cure for syphilis. Yet the men were denied this life-saving treatment. The study continued, a grotesque dance of deception and suffering, as the researchers turned a blind eye to the pain they inflicted. Time ticked on and hope faded, leaving behind a trail of despair. On July 25, 1972, John Heller of the Associated Press broke the story that appeared simultaneously both in New York and Washington, that there had been a 40-year non-therapeutic experiment between the start of the study in 1932 and 1947, the date when penicillin was determined as a cure for the disease. Dozens of men had died and their wives. Children and untold number of others had been infected. This set into motion international public outcry and a series of actions initiated by U.S. federal agencies. The Assistant Secretary for Health and Scientific Affairs appointed an ad hoc advisory panel comprised of 9 members from the fields of health administration, medicine, law, religion, education, etc. to review the study. Reviewing the results of the research, the panel concluded that the study was ethically unjustified. The panel articulated all of the findings in October of 1972, and then 1 month later, the Assistant Secretary for Health and Scientific Affairs officially declared the end of the Tuskegee study. With all that said, I just want to make a point with, no matter what timeline you jump to in American history, Black Americans always get screwed over by its own government, which is really something to think about.